Anxiety and fear, the psychology of emotion, is rich with diverse and opposing views on the nature and function of human emotions. All emotion theorists who accept the existence of basic emotions, however, count fear as one of them. As a part of our emotional nature, fear occurs as a healthy adaptive response to a perceived threat or danger to one's physical safety and security. It warns individuals of an imminent threat and the need for defensive action. Yet, fear can be maladaptive when it occurs in a non-threatening or neutral situation that is misinterpreted as representing a potential danger or threat. Thus, two issues are fundamental to any theory of anxiety: how to distinguish fear and anxiety, and how to determine what is a normal versus an abnormal reaction. Defining fear and anxiety. Many different words in the English language relate to the subjective experience of anxiety, such as dread, fright, panic, apprehension, nervous, worry, fear, horror, and terror. This has led to considerable confusion and inaccuracy in the common use of the term anxious. However, fear and anxiety. Anxiety, a common but multifaceted condition 5, must be clearly distinguished in any theory of anxiety that hopes to offer guidance for research and treatment of anxiety. In this influential volume on the anxiety disorders, Barlow stated that fear is a primitive alarm in response to present danger, characterized by strong arousal and action tendencies. Anxiety, on the other hand, was defined as a future-oriented emotion characterized by perceptions of uncontrollability and unpredictability over potentially aversive events and a rapid shift in attention to the focus of potentially dangerous events or one's own effective response to these events. Beck, Emery, and Greenberg offered a somewhat different perspective on the differentiation of fear and anxiety. They defined fear as a cognitive process involving the appraisal that there is actual or potential danger in a given situation. Anxiety is an emotional response triggered by fear. Thus, fear is the appraisal of danger. Anxiety is the unpleasant feeling state evoked when fear is stimulated. Barlow and Beck both consider fear as a discrete, fundamental construct, whereas anxiety is a more general subjective response. Beck et al. Emphasize the cognitive nature of fear, and Barlow focuses on the more automatic neurobiological and behavioral features of the construct. On the basis of these considerations, we offer the following definitions of fear and anxiety as a guide for cognitive therapy. A couple of observations can be derived from these definitions. Fear, as the basic automatic appraisal of danger, is the core process in all the anxiety disorders. It is evident in the panic attacks and acute spikes of anxiousness that people report in specific situations. Anxiety, on the other hand, describes a more enduring state of threat or anxious apprehension that includes other cognitive factors in addition to fear, such as perceived aversiveness, uncontrollability, uncertainty, vulnerability, and inability to obtain desired outcomes. Both fear and anxiety involve a future orientation so that what-if questions predominate. For example, what if I bomb this job interview? What if my mind goes blank during speech? What if my heart palpitations trigger a heart attack? The distinction between fear and anxiety can be illustrated by Bill, who suffers from obsessive-compulsive disorder, OCD, due to a fear of contamination and so engages in compulsive washing. Bill is hypervigilant about the possibility of encountering dangerous contaminants, and so he avoids many things that he perceives as possible contamination. He is in a continual state of high arousal and subjectively feels nervous and apprehensive due to repetitive thoughts of contamination. For example, what if I become contaminated? This cognitive behavioral psychological state then describes anxiety. If Bill touches a dirty object, for example the doorknob in a public building, he quickly experiences fear, which is the perception of imminent danger. For example, I've touched this dirty doorknob. A cancer patient may have recently touched it. I could contract cancer and die. Thus, we describe Bill's immediate response to the doorknob as fear, but his almost continuous negative affective state as anxiety. Anxiety, then, is of greater concern for those individuals who seek treatment for a heightened state of nervousness or agitation that causes considerable distress and interference in daily living. Consequently, it is anxiety and its treatment that is the focus of the present volume, normal versus abnormal. It would be difficult to find someone who hasn't experienced fear or felt anxious about an impending event. Fear has an adaptive function that is critical to the survival of the human species by warning and preparing the organism for response against life-threatening dangers and emergencies. Moreover, fears are very common in childhood, and mild symptoms of anxiety, for example occasional panic attacks, very social anxiety, are frequently reported in adult populations. So, how are we to distinguish abnormal from normal fear? At that point, does anxiety become excessive, so maladaptive that clinical intervention is warranted? We suggest 5 criteria that can be used to distinguish abnormal states of fear and anxiety. It is not necessary that all these criteria be presented in a particular case, but one would expect many of these characteristics to be present in clinical anxiety states.